Oxygen safety. Oxygen therapy is the administration of oxygen to increase the supply of oxygen to the lungs. This increases the availability of oxygen to the body tissues. Oxygen therapy is used to treat breathing difficulties and is prescribed by a doctor. Home health aides should never stop, adjust or administer oxygen for a patient. Oxygen will be delivered to the home in cylinders or tanks or produced by an oxygen concentrator. Compressed oxygen and liquid oxygen are stored in tanks of varying sizes. An oxygen concentrator produces and distributes oxygen but does not store oxygen. The company supplying the oxygen will service the equipment and provide training on its use. Oxygen safety. Some patients receive oxygen through a nasal cannula. A nasal cannula is a piece of plastic tubing that fits around the face and is secured by a strap that goes over the ears and around the back of the head. The face piece has two short prongs made of tubing. These prongs fit inside the nose, and oxygen is delivered through them. A respiratory therapist fits the cannula. The length of the prongs, usually no more than half an inch, is adjusted for the patient's comfort. The patient can talk and eat while wearing the cannula. An oxygen concentrator is a box-like device that changes air in the room into air with more oxygen. Oxygen concentrators are quiet machines. They can be larger units or portable ones that can move or travel with the patient. They have at least one filter that typically needs to be cleaned once per week. Oxygen concentrators run on electricity. They are plugged into wall outlets and are turned on and off by a switch. It may take a few minutes for the oxygen concentrator to reach full power after it is turned on. Patients who use oxygen concentrators will often have a backup oxygen tank available in case of a power outage. Patients who do not need concentrated oxygen all the time may use a face mask when they need oxygen. The face mask fits over the nose and mouth. It is secured by a strap that goes over the ears and around the back of the head. Plastic tubing connects the mask to the oxygen source. The mask should be checked to see that it fits snugly on the patient's face, but it should not pinch the face. It is difficult for the patient to talk when wearing an oxygen face mask. The mask must be removed for the patient to eat or drink anything. Oxygen is a very dangerous fire hazard, because it makes other things burn. Working around oxygen requires special safety precautions. Guidelines for working safely around oxygen. Keep oxygen at least 6 to 10 feet away from any open flame or heat source, such as candles, a gas stove, or from anything that may cause a spark. Any type of open flame near oxygen is dangerous. Do not smoke or let anyone else smoke near the oxygen equipment. No smoking sign should be in every room where oxygen is used. Oxygen and use sign should be put on the door. Oxygen can be irritating to the nose and mouth. The strap of the nasal cannula or face mask can also cause irritation around the ears. Make sure to check the nasal area and behind the ears for signs of irritation. Report to the agency any irritation you observe. Smoke alarms should be in the patient's house or apartment. Do not use an extension cord with an oxygen concentrator. Do not put electrical cords or oxygen tubing under rugs or furniture. Do not use petroleum-based products, such as Vaseline or chapstick, on the patient or on any part of the nasal cannula or mask. Oil-based lubricants can be a fire hazard. Guidelines for working safely around oxygen, continued. Oxygen cylinders should be stored in an upright secure position, in an oxygen storage rack, in a well-ventilated area away from open flame, heat source or direct sunlight. Do not cover them with cloth or plastic. Avoid using fabrics, such as nylon and wool. They can cause static electricity discharges. Remove all fire hazards from the area. Fire hazards include electrical equipment, such as electric razors and hair dryers, as well as space heaters, matches, cigarettes and flammable liquids, alcohol and nail polish remover. Read the labels on liquids if you are unsure whether they are flammable. If flammable, such liquids must be removed. Learn how to turn oxygen off in case of fire. Never adjust the oxygen setting or dose. Notify your supervisor and the agency if a fire hazard is present, and the patient does not want it removed. Oxygen safety. For patients using oxygen tanks, count and record pulse and respirations before and after the patient uses the oxygen tank to see if there are any changes if directed. The flow meter shows how much of the oxygen is flowing out to the patient at any time. It should be set at the amount stated in the care plan. If it is not, report this to your supervisor and the agency. Do not adjust oxygen level. Make sure that the humidifying bottle has distilled water in it and is attached correctly. Wash the humidifying bottle according to the care plan or equipment supplier's instructions. Change the nasal cannula when ordered. It will need to be changed when it is hard or cracked, at least once every 2 weeks. It should also be changed after the patient has had a cold or the flu. Wash the plastic tubing once or twice per week with soap and water and rinse it well. Make sure the oxygen tank is secured and will not tip over. For patients using liquid oxygen, turn off supply valves when the reservoir is not in use. Do not tip the reservoir on its side. Make sure the reservoir is not in a closet, cupboard or other closed-in space. Do not cover the reservoir with bed linens or clothing. When lifting the reservoir, lift with 2 hands. Do not roll the reservoir or walk it on its edge. Do not touch any frosted parts of the equipment, because the cold can cause frostbite. Do not touch liquid oxygen that also causes frostbite. Report if the reservoir is leaking. Oxygen safety. For patients using oxygen concentrators, count and record pulse and respirations before and after the patient uses the oxygen concentrator to see if there are changes if directed. The oxygen concentrator dial must be set at the same rate as listed in the care plan. If it is not, report this to your supervisor and the agency. Do not adjust oxygen level. Check the humidifying bottle each time the device is used to see that it has distilled water in it and that it is screwed on tightly. Distilled water, not tap water, must be used, because minerals in tap water may clog the tubing. Make sure that the concentrator is in a well-ventilated area, at least 6 inches from the wall. Because the air filter cleans the air going into the machine, brush it off daily to remove dust.